President Biden's $1.9 trillion stimulus package includes expanded health care coverage for new mothers. Those who qualify can now receive Medicaid for up to 1 year after delivering a baby. Coverage previously expired 60 days after delivery. Health experts say this could be an important step in combating high maternal mortality rates in the U.S. For more on this, I want to bring in Jamie Daw. She is an assistant professor of health policy and management at Columbia University. Professor, welcome. Thanks very much for being with us. The U.S. currently has the highest maternal mortality rate among industrialized countries. Why is that? What contributes to such a high rate?
Right. So what you said is true. The U.S. has the highest maternal mortality rate among high-income countries. American women today have a higher chance of dying than their own mothers a generation before. I think the really important thing to understand here is that this is not a problem that affects all women equally. There are very stark racial disparities. So Black and Indigenous women die from pregnancy-related causes at 3 to 4 times the rate of white women in the U.S. So we should really think about this as a health equity problem. And this health inequity stems from disparities in access to health insurance, access to high quality care. For example, right here in New York City, research has shown that Black women deliver at hospitals of inferior quality compared to white women. And these disparities and this issue is really also a direct result of structural racism, that affects everything from neighborhood safety, the stress that mothers feel during pregnancy, education, and economic opportunity, all of which sort of affect health outcomes for pregnant women and for children.
Well, what is the importance of postpartum medical care? How would expanded Medicaid help combat high maternal mortality rates across the U.S.?
Right. So a lot of times when people think about maternal mortality, they think about deaths that occur during pregnancy and at birth or during childbirth. But recent evidence has shown that about 1/3 of maternal deaths actually happen in the year after birth. So we're really rethinking what this postpartum period is and the importance it plays in promoting women's health. So we really want to make sure that women can get timely access to physical and mental health care, in addition to other social supports that they may need. And one of the big issues you mentioned in your introduction is that Medicaid, which covers about half of all the births in the U.S. are covered by Medicaid, it has this deficiency in the sense that it only covers women during pregnancy up to 60 days after their birth. So you've given birth, 60 days later, you hit this cutoff, and it's very arbitrary and it doesn't reflect women's underlying healthcare needs. And what happens is that many women end up going uninsured in this period where we know they continue to have high healthcare needs and we know they continue to be at risk of maternal morbidity and mortality.
Well, Professor, how will extended Medicaid be funded? Will states have to pay a portion of the costs?
Yeah, exactly. So this extension is going to be jointly funded by the states and the federal government. And one thing that's really important to understand is that it's optional, right? The federal government, the American Rescue Plan, is not requiring states to adopt it. It's going to be optional. So we still have to see how many states are actually going to implement this option. But it will be jointly funded by the states and federal government. The amount the feds are going to pay will vary by state, but it will be at least half of the cost of the program in all states. But we may expect that, states that are concerned about their budgets, especially because of COVID-19, may be, less likely to adopt this than they would have, before COVID-19 when the economy was really doing well.
Well, under the new Medicaid expansion, low-income mothers could still become uninsured a year after delivering their baby. What challenges might some moms be facing a year after delivery?
Yeah, this is an excellent point. I said before that the 60 days was arbitrary, and we could also say 1 year is arbitrary, right? We're sort of extending Medicaid, kicking this can down the road a little bit from 60 days to 1 year. Postpartum women at 1 year have the same needs as any other American may have in terms of, needing access to health care. We want to ensure that everyone has access to health insurance, regardless of their income, their health needs, their pregnancy status, right? We all have physical and mental health needs that need to be taken care of. So I think this sort of highlights the complexity of the current health insurance system, and how, all of these different programs and their different cutoffs, and then, women and other folks needing to move between different types of coverage just makes it really challenging for everyone, not only postpartum women, to be able to secure a continuous access to health insurance. So this is, there's a broader issue with the American healthcare system and health insurance, and this extension is not going to solve that problem.
All right, Jamie Dodd. Jamie, thank you very much.
Thank you so much for having me.